Hello, everyone. Welcome to PCE Final Frontier podcast. I am Shivangi, your PCE guide at PCE Final Frontier, helping one student at a time. Visit our website www.pceff.com to enroll in our courses today. Welcome, listeners. Today we are going to talk about diabetes mellitus. What is diabetes? It is a chronic metabolic disease that occurs when the body is not able to produce enough insulin or it cannot use insulin properly, which causes high levels of blood sugar or blood glucose in your bloodstream. Over time, as we all know, this can damage the heart, the blood vessels, kidneys, nerves, causing neuropathy, eyes, causing lots of vision disorders, vision loss, kidney problems, and other heart issues. Now, there are different types of diabetes mellitus, type 1 and type 2. Diabetes can also occur during pregnancy, known as gestational diabetes, or some babies right after they are born can be diagnosed with diabetes, known as neonatal diabetes. The main difference between all of this is an underlying mechanism which causes the blood glucose or blood sugar levels to rise. Now, I have a mnemonic that can help us remember the signs and symptoms of diabetes. It's 3 P's. One P stands for polyuria, the second P stands for polydipsia, and the third P stands for polyphagia. Polyuria refers to excessive urination. Polydipsia means excessive thirst. And polyphagia refers to excessive hunger or increase in appetite. These three symptoms are often present in individuals with diabetes mellitus, more commonly seen in type 1. And this helps for a quick diagnosis of patient. So, for example, you are working with a patient in a clinic and the patient talks to you about this. Like, hey, my mouth is dry. I feel so thirsty even after one workout exercise. Or I need to go use the bathroom. I'll be back. And you notice a pattern, you notice a trend like, oh, looks like he's using the bathroom a lot or is more thirsty. Or sometimes a patient will tell you, I am very hungry. I feel like I am gaining weight. So after talking to the patient and after you remember the 3 P's mnemonic that you just learned, you can help the patient. You can tell them, I think you are showing signs and symptoms of diabetes. When was the last time did you have a blood work done? I think we should reach out to your doctor, your primary care, and have this further investigated. Once you know that the patient has diabetes or the test results come back positive, or if it's like the blood sugar is high, that will that will change the way the treatment is done. It does not change much on the treatment point of view, but you have to be very careful. You have to keep an extra eye. Make sure the blood sugar doesn't drop when they are exercising, or they don't end up with a wound somewhere that it's hard to figure out, hard to find, and it will take forever to heal. So keep these mnemonic in mind, and that will help. That will really help when you put into practice, when you start treating patients. Now, the treatment for diabetes, there is no cure, like a definite treatment for diabetes. What you can tell your patient to do is follow A, B, C, D, E. Remember this mnemonic, A, B, C, D, E. where A is A1C control. Educate your patient. Tell them to keep their A1C below 7%. Have them keep their blood pressure properly managed. So that's the B. Keep the blood pressure below 130/80 mmHg. C stands for cholesterol management. Aim to keep your LDL cholesterol below 100 milligram per deciliter. D, diet and exercise. Encourage a healthy diet and regular physical activity. E stands for education and support. Provide education and support to help patients manage their conditions. There is a lot of information available online, a lot of information available at the doctor's office, a lot of support groups, help groups, a lot of workout classes. The patient is not alone. They can always find education and support and can learn to treat or manage the symptoms of diabetes. That's all for today. Thank you for joining today. Reach out to us at support@pceff.com for any questions. Follow us on social media on Facebook, Instagram, and YouTube for more content. Have a wonderful week and keep learning.